Welcome to the AUA News Inside Tract podcast, an official podcast of the American Urological Association. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.
Welcome back to the AUA Inside Tract podcast. I'm Dr. Kevin Koo. I'm an endourologist at Mayo Clinic in Rochester, Minnesota, and I'm chair of the Federal Advocacy Committee for the AUA.
And I'm Grace Hyun. I am a pediatric urologist at NYU, and I am also on the Federal Advocacy Committee as well as the AUAPAC board.
Today, we're talking about the AUA Census and insights from the AUA Census data that we can learn about what our community is doing in practice and the challenges that we face in the practice of urology today. And we're focusing today on an issue that has become a major challenge for many practices, as well as an important federal advocacy concern, which is prior authorization. Now, prior authorization is a health plan cost control process that can lead to delayed or abandoned care and negatively impact patient outcomes. Dr. Hyun, can you tell our audience a little bit more about what prior authorization might mean and how practices might be facing prior auth?
So you can see why it all started, right? So, healthcare costs are out of control for a lot of things. There's overuse. There is people who may practice things and over order tests and things of that nature. So they wanted to control costs. Okay. So what they started to do was saying that for certain tests and certain things that we order for and ask for, that we needed to get some sort of authorization procedure from the powers that be to let us allow patients to get these tests. But then you can also see on the flip side how that can also get out of hand with bureaucracy and administration and paperwork and red tape. So what ends up happening is that you need to hire people to make phone calls to companies to be allowed to get your testing done. Now, we're also talking to people who are savvy in this and already know much of this, but it's really more how this has kind of gotten out of hand. And the number of calls that we have to make, the number of people that we have to talk to, the number of ways that we need to get justifications for the stuff that we know that we should be asking for and that are good for our patients. It has become overblown and completely out of control. And it's one of the biggest things that people complain about is how much time they need to spend to get good care for their patients for the tests that they need.
Exactly. This is a process that many insurance carriers are now using to try to control what is being ordered and the types of access that patients have to diagnostics, to evaluations, to procedures, to medications that their urologists are ordering for them. And many urologists and their practices are facing an increasing administrative burden having to deal with prior authorization requests. So it's not only that it's getting in the way of patients getting the care that they and their urologists have agreed that they need, but also it's adding to the paperwork, the phone calls, the non-clinical care that urologists and their practices have to deal with. And that not only increases time spent away from taking care of patients, time spent away from doing the things that we in our practices want to do, but it also adds to the burden of being a urologist and the career satisfaction and burnout concerns that our specialty continues to face. Do you see that where you're practicing as well, Dr. Hyun?
Absolutely. So the more and more people you talk about, it's one of the biggest concerns that they have in practice is exactly what you talked about. The number of people that you need to hire, the number of people that are just, that's all they do all day long is just making phone call after phone call. The denials that you get from insurance companies, have to recall again, talk to one person, talk to another person. It really has become an overbloated, overblown thing. And it just is so much more work than we sign up for. This is not why any of us went into medicine, is to beg people to let us take care of our patients, and the roadblocks and obstacles that have been put forth to make these things not happen in order to curb costs. But then you can easily see how it actually makes more cost because of the fact of the time that's spent at the people you need to hire, et cetera, to get these things done. And then delay of care. I mean, why are we doing this to our patients and we're trying to explain what they need? You agree to it and then you can't do it.
Exactly right. And when it comes to the actual real world practical impact of prior authorization on urologists, their practices, and their patients, we can turn to the AUA Census to learn more about what exactly that impact looks like. As many of you know, the AUA Census is an annual survey that is sent to all AUA members. And practicing urologists like us can give our insights and give our feedback about what it is we're seeing in practice and how practices like prior authorization affect what we do and the patients that are and the care that our patients are able to access. So from the 2023 AUA census, there was a special set of questions about the impact of prior authorization. And the results really speak for themselves. More than half of practicing urologists in the United States believe that clinical outcomes are moderately affected by treatments that require prior authorization, 54%. And over a third believe that these treatments are extremely effective, 37%. It was less than 10% that did not believe prior authorization had any effect on their treatments or treatments of patients. And so this really is a astounding majority that have said that in their day-to-day routine practice, prior auth not only has an effect, but it has a moderate or even significant effect on patient access to care. Does this top line finding surprise you, Dr. Kim?
No, not at all. I mean, I think this is something that we all talk about within our practices. And the important thing, and I think this is something that it should also be a take home while we talk about this, is how important the census is, right? So filling out the census, letting everybody know exactly how you're feeling, because clearly you're not the only one, right? And the more data that we can get about how many people are affected by various things in all of our practices, makes our voice even stronger and stronger. So maybe it's actually more than 54% if everybody had filled out the census. It could be as high as 75, 80%. Would that surprise us? Absolutely not. Right. So these numbers can really be very strong and really very insightful the more and more people fill out these census to make sure that we all understand what we're all going through. So absolutely not. I'm actually surprised it's only 54%. I think it's underreported, to be perfectly honest.
And it's not only that treatments in general and access to care is in general affected. We can use AUA census data to dig deeper and understand exactly what kind of impact prior authorization is having. So, for instance, we know from the census that urology practices routinely receive and have to respond to prior authorization requests. So again, this is time spent away from the bedside, away from the clinic, away from surgery and the hospital to deal with this administrative paperwork. So when urologists were asked about the average number of prior authorizations submitted on behalf of patients in a typical week, there was just under 50% of practices that reported greater than 10 weekly authorizations, whether that's phone calls, paperwork that has to be faxed or returned with documentation. So more than 10, and about a quarter of practices reported more than 20, and some even more than 40 a week. And so you can imagine going back and forth with these insurance carriers, responding to requests, justifying clinical decisions that urologists have made with their patients. It can be very stressful and can take up a large amount of time. Dr. Hyun, you're in your practice, your specialized practice, do you have to deal with prior authorizations?
Sure, absolutely. So, I mean, I wish I could say that I was one of those groups of people that only had to do a few, or that, I'm in that 10% that believe I'm not affected. I'm very jealous of those people, honestly. So, what ends up happening is you have to also, this is also continuity of care and how communication is important, how you make sure things don't get missed or dropped because of the fact that you can't even just make one phone call and make sure something happens. You have to go back. You have to do, so then at what point, how much of your care has actually been done? Is it 80%? Is it 85% of this? So every day you're making sure that all the boxes are checked and the, I's are dotted and T's are crossed until you can actually continue and feel like, all right, we did everything for this patient now. The prior authorization's all been done. we can make sure we can go to the next step. So these are all like very little insidious things that all actually end up, compiling all on top of each other, and how it's become so much harder to make sure that we have comprehensive 100% care of our patients, that in our brain was so easy, but the insurance companies have made so difficult. And it's not fair to us, and it certainly isn't fair to the patient on how we have all agreed is the standard of care, and how these obstacles have come, again, albeit in the beginning might have been for good reasons, to curb costs, but now clearly has gone the other way and has made things much more expensive and just much harder for no reason whatsoever. In the name of efficiency, we've become inefficient.
Exactly right. And the tempo of prior authorizations has accelerated. And we know that because the census inquired about the need for prior authorization for different types of services and treatments, and whether they've increased over the past 5 years. And here, the data is very compelling and very clear. The vast majority of urologists reported on the census that prior auth requests, have increased for diagnostic tests, 78%, for medications, 75%, and for medical procedures, 61%. So it's not just for one type of treatment or one type of service. It's across the spectrum of what urologists do. We order diagnostic tests to make a clear diagnosis. We order medication so that we can treat patients in non-surgical ways when it's appropriate. And of course, we perform medical procedures. And across this entire spectrum of urological practice, urologists are reporting that requests for prior auth are only going up, which means that there's more paperwork to do, more patients are being affected and potentially delayed or denied necessary and appropriate care. And that takes a huge toll, not only on urologists, but also on patients.
Without a doubt. Without a doubt. So, I mean, I think all the work that's been done, especially, the people who make the census and make these truly excellent questions to really get down to the nitty gritty of how we're working and what we need to do in order to, what's the change? How do we make changes with this, right? So that's the next step. We all sit here and we bellyache about how annoying it is and how unfair it is, right? So then this is where what we do on the Federal Advocacy Committee makes a difference, right? So we go and try to promote bills that are going to make it easier for all patients to get the care that they deserve and that they want and that they should want and that they should get.
Exactly right. And this is why prior authorization has been a critical federal advocacy priority for our committee and for the AUA for years, and especially this year. Earlier this year at the 2025 AUA Summit in Washington, D.C., hundreds of urologists gathered on Capitol Hill to speak to our lawmakers and to tell them exactly what the census found, which is that prior authorization is negatively impacting the way that we are able to care for our patients. It's negatively impacting patient access to safe, timely, equitable urological care. And we need reforms so that prior authorization doesn't get in the way of the treatment that our patients deserve and that the care that we want to provide. And there are two specific pieces of legislation that we've been following closely, have been championing with our lawmakers that really addresses this exact issue. The first is the Improving Seniors Timely Access to Care Act, which would establish an electronic prior authorization program to try to make prior auth when needed more efficient. That's exactly that efficiency topic that you were getting at, Dr. Hyun.
So it's really great. So the other thing that I think is so fabulous in what we try to do is that we try to listen to our patients, but we also try to listen to our own urologists of our 11,000 constituents of the AUA, right? So we send this, the census is sent out by the AUA every year, but then there's also the Federal Advocacy Committee questionnaire that's sent out every 2 years. So this is one of the things that is also brought up in that is prior authorization. So we listen to you, we go through that, and we try to figure out what is that is bothering us the most. What can we bring to Congress and ask them to change, because it is something that is bothering all of us. So once those questionnaires are completed, and the more people that complete those questionnaires, I beseech you to fill these questionnaires, because we are responding to your requests and what you want. we too are patients, right? We're patients too, unfortunately, I guess, that, you know, I don't want my stuff to be delayed by prior auth either. So this is what we take and we bring to Capitol Hill and say, doesn't electronic prior authorization make sense? We do everything else electronically. Like, why can't we make this as easy a process as well? So the more that we can come together at the summit, go to Capitol Hill, try to represent our constituents ourselves as a member of the voting public, this becomes a more and more important thing and more powerful as we can go and say, every single one of us wants something done.
Exactly. And this is the power of data. This is the power of AUA data and the data that we as a community provide and then use to empower and accelerate our advocacy. Another bill that relates to prior auth that we've been really strongly advocating for with Congress is the Reducing Medically Unnecessary Delays in Care Act. And this bill gets at same specialty physician review. Dr. Hyun, I'm sure you, just as I, have had to deal with these peer-to-peer conversations where we have to justify our decisions with a quote-unquote peer. But how many times do you actually speak to somebody who understands the care that you're asking for or wanting to provide? How many times do you speak with a urologist or urological clinician?
Never, not one time.
Exactly right. Exactly right. It's not only that the specialty care we provide is very specific, but sometimes the reasoning really requires somebody who understands what it is we're doing. And again, the AUA census here provides important insight because the vast majority, 75% of urologists, say that they rarely or never speak to somebody who performs these services or actually understands the specialty. And you can imagine how this would make those conversations more challenging or even lead to miscommunication and ultimately poor decisions about the prior authorization request. So the Reducing Medically Unnecessary Delays in Care Act gets at same specialty physician review. If we're going to get on the phone or get on a virtual call with someone to justify our decisions, it should be someone who actually understands our specialty care field. Doesn't that make sense to you?
Yes, of course.
Exactly. So, so I think this is the way where AUA census data can not only provide important insight on our practice patterns and the challenges that our practices face, but also then empower our advocacy to our federal legislators, as well as the state and regional level as well. And if urologists want to participate, if they want to be able to engage in this and share how these decisions are affecting them, Dr. Hyun, how can they get involved and participate?
Oh, I think there's so many ways, and that I think that's also a wonderful thing about our field, to be perfectly honest with you. So you can certainly fill out the census. Every questionnaire that comes to you is something that I I beg you, begging everyone to fill out because again, data is power, and the more we know, the more we can help each other, and the more we can go as a united front to those people who are not trying to help us, or honestly, and maybe not even in a harmful way, they just don't even realize. So it's really about education and teaching of all the things that might be happening to us that people don't even know and want to help us, would be happy to help us. So that's certainly one way. I think every questionnaire or email that comes to us that's asking us to reach out to our local representative, the AUA, the FAC, and the AUAPAC make it very easy for you to do. Like, put your name here, put your zip code here, and just put in your address, and we'll fill out the rest of it. Just press send. And this way, we will send your constituents, like your representative, various different letters that we send saying, please do not cut Medicare reimbursements. Please make it so that we can make a prior authorization easier. Because again, the more numbers our representatives have, the more they can go and argue for us, saying that this is a problem. Because why would they know? They're not doctors. They don't know what's going on. Instead, they're getting the ear of every other person that's talking to them. So we need to be the ones that are talking to them. And that can be a way that you can participate without even leaving your home. But then if you do want to leave your home, you could come with us to the AUA Summit and come down to DC and see what a really fantastic experience that is, to go to Capitol Hill, to go and meet with your representative or the people in your district, with the various other urologists who are as passionate about this as everybody else is, and really understand how this all works and why it works the way it does. And I think that in and of itself is something that's very important for every person to know as a citizen of this country.
I completely agree. And so there are many things that every urologist can do year round, but right now, our community and our colleagues can mark their calendars for February 2026 for the AUA Summit on Capitol Hill in Washington, D.C. And right now, our colleagues can also take part in the 2025 AUA Census. They can do so by going to auanet.org/take census, all one word. And an important part of this is also our advocacy and putting our dollars to work to advocate for important legislation. And so contributing to the AUAPAC, the Political Action Committee, is something that we encourage every AUA member to do. To do that, please go to myauapac.org and please give generously so that we can use this data and accelerate our advocacy on behalf of you, on behalf of our community, and of course, on behalf of our patients. Well, thank you very much for joining us today, Dr. Hyun, and all of our colleagues. Is there one final takeaway from our discussion today, Dr. Hyun, that we really want everybody to know?
Well, I'm really glad that you brought up the AUAPAC at the end of this, because if there's anything that can help us really change minds, it would have to be in Congress. It has to be on Capitol Hill, because we all already know how we feel about how our practices are being affected. So in order to do that, we need to send people on Capitol Hill every single day so they remember who we are. It is wonderful that we go down and we, have our FaceTime with our representatives, but we have full-time jobs. You are where you are in Minneapolis and I am where I am in New York. Like, we can't go down to DC every day, but thankfully we have hired people who can do that for us, who are extremely good at what they do. But the only way they can do that is with support and financial support. And every other lobbying group in this country has figured this out of how this works. And it's not bad. It's just facts. So therefore, we need to donate to the AUAPAC so that we can go do the same exact thing and play the same game that everybody else is doing in order to help ourselves continue with the practices that we want to do, with the great care that we give. So please go to AUAPAC on the website, donate $250 so that we can all go and do the medicine that we studied so hard to do.
Thanks for that. It's an important cause. Please check out the links in the description for this episode, and we hope that you'll join us year-round to continue to advocate using AUA Census data, using insights from across the country at helping to push the practice of urology forward and protect it for our patients. Thank you once again for joining us on today's episode of the AUA Inside Tract podcast. We've been Dr. Kevin Koo and Dr. Grace Hyun, and we'll see you again soon on another episode. Thank you very much.
This has been an AUA News Inside Tract podcast. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.